The more chemo you get, the better you'll do in the long run. But
well, the problem is that sometimes when you get chemo, the cancer cells start mutating and actually start resisting the chemo. So there's something called resistance, and sometimes the chemo is teaching the cells to be resistant.
Sure.
So actually, the more chemo you give, the more resistance you have.
Okay.
And also, you're depressing the body's immune system. There's side effects. In this study, there were side effects of hand-foot syndrome, where patients had significant symptoms in their hands and feet. There were neuropathies, which is usually pain or numbness in the body from damage to the nerve. So anyway, they looked at the results, and the first episode of progression was earlier in the group that had no treatment. So you'd expect that if you got the chemo for more, that would probably delay the first recurrence of the cancer, and it did. There were 558 patients from 74 centers in Holland, and they were randomly allocated to these two arms and followed for about 3.5 years. So the first episode occurred in the observation arm, the untreated arm, at 4 months, and occurred in the chemo arm at 8.5 months. So it makes it sound, well, I want to go on chemo, right?
Mm-hmm.
Because it doubles the duration of no progression. But then the second progression, so that was the first progression. The second progression occurred at 10.5 months in observation and 11.5 months with chemo.
Mm-hmm.
So you can see that the benefits of chemo are getting less as time goes on.
Yeah.
And that kind of is consistent with what I talked about before, of the more chemo you get, the more resistance you have.
Yeah.
And then they looked at overall survival. How long are these patients with metastatic colorectal cancer getting treatment or getting no treatment live?
Is there any difference?
There was difference. It was 18.2 months with no chemo and 21.7 months with chemo.
Mm-hmm.
So it was about 3.5 months difference.
Now, is that a big difference in the grand scheme of things?
Well, there's a p-value. Do you know what p-values are?
Yeah, so it basically is about the power of the study, or about the power of the results.
Yeah, the power of the results.
Valid.
Is it true? It gives us an idea. Are those two numbers really different? Because
right.
You can have 10,000 people in a study, or you can have 10 people in a study, and the p-value will give you an idea of the two results. Are they really different? And usually we use less than 0.5 as the dividing point. Well, this was 0.35. So yes, the two arms were different. You live 3.5 more months if you take the chemo. We talked about this hand-foot syndrome. If you had no chemo, you had 0%. If you took the chemo, you had 22% hand-foot syndrome. And the neural toxicity was 10% with chemo, 5% without chemo.
Mm-hmm.
And the cost, these drugs are fairly expensive. They cost about more than $5,000 a month. You're talking about more than $125,000. And then you've got you're hooked up to chemo regularly versus you're out living your life. So you have psychological issues also.
Right. Yeah, it's true.
So patients have to know it. Some people are going to choose one. Some are going to have to choose another. But I think if you have the data, you can at least say, okay, yeah, I want chemo. I want that extra 3.5 months. I don't care about the chemo and the side effects. I just want to live every extra day I can.
Mm-hmm.
And then there's other people who say, look, I want to live my life, and 3.5 months don't matter to me as much as being free and living my life and traveling and seeing my kids and not being in the hospital and not having my hands and feet break out. So it's a nice study, and we should congratulate this woman for doing this study and telling us about what are the actual benefits. So patients don't have to be uncertain about which arm. They can choose it based upon facts, which is really the best way.
Yeah, it's a very difficult decision, too, for patients.
It's very difficult, but at least if you have the facts, you can say, go home to your family and, which do you want?
Yeah.
We're going to break. We have this tremendous sponsor, and the sponsor has a beautiful voice. So we're going to hear from the sponsor, and then we're going to be back to take your calls and talk more medical news with you shortly. Thank you. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with Body Radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery, New York.
News Talk Radio 710
WOR.
At Radiosurgery, New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery, New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
We're back. Hello. We hope you're all fine and with us today and waking up and seeing the sunrise. I think we're getting close to sunrise here, although it's getting darker and darker at 6 a.m.
That's right. I think it's going to rain today.
So sometimes some women call and say we don't focus on them, and I try actually every week to focus on everybody. There's obviously thousands of different kinds of cancer, and sometimes people get angry at me that I don't talk about their cancer. So it's not that I'm ignoring it. You can call in. You can start the conversation. You call in the show, or if you call in during the week, I actually sit at my desk and make a list of patients and calls, and that's really what stimulates a lot of my thoughts and how we end up focusing on particular topics. One focus, which is a weekly focus, is for the woman who has a breast lump who is afraid to see her doctor. And now we've been talking about it for the last month, and actually we have multiple women who have come to us, some with breast lumps that have been there for a couple of years, some for a decade. And I would just urge you, if you've got that breast lump and you've been afraid to see your doctor, give us a call. And it's not painful. We can just biopsy it, stick a little needle in like a little pin, and we numb up the area. And we do usually a mammogram and a PET scan. So within a day, you'll know exactly what you have and can have treatment. There's no reason to lose your life because you're afraid or embarrassed.
Right.
So I'd really encourage women. And we have a particular woman, I call her Katharine Hepburn because she's so beautiful, but she came in. She was one of the women like this, and I see her now every day. She's getting treatment, and I told her that let's get the treatment, and I think she's going to be a lot better and happy that she did go through this. And I think any woman who's got a breast lump that's been ignored, please give us a call. You don't have to call the radio show if you don't want to. You can call me privately, and our private number during the week is 212-CHOICES. 212-CHOICES, and I'll pick up the phone and talk to you and answer all your questions privately if you don't want to call us on the show. And there's also another disease that affects mainly women, but not only women, and that's human papillomavirus.
Mm-hmm.
Are you familiar
Sure.
with that, Rob?
I am, yeah. So
What do you know about it?
Well, I know that it leads to cervical cancer.
Right.
Basically.
So there's a vaccine now also.
Yeah.
And I should tell our listeners we have one of the major figures in the vaccine world will be with us next Sunday night at 9 p.m. on this show, WOR, Dr. Paul Offit, who's written several books, one of which is Do You Believe in Magic, which is an incredible book, which we're going to be discussing. He also wrote about the Cutter incident, which was about Sabin and Salk's rush for the polio vaccine.
Sure.
And he also wrote a book called Vaccinated, which talks about the history of vaccines from Jenner and milkmaids who were immune from smallpox when it was devastating millions of people.
Mm-hmm.
Just to talk about the power of these infectious diseases, 300 years ago, there were 70 million Indians in America. And now there's 700,000. So 99% of the Indians in America were wiped out by smallpox, brought by Europeans. And Cortez, with 400 men, came to Mexico to attack the Aztecs, who had millions of Aztecs versus 400 with Cortez from Spain. And within a short period of time, the millions of Aztecs were being wiped out, and they surrendered to 400 of Cortez's men because of smallpox. So we here today, who are living a healthy life, have a lot of gratitude due to just a few men. There's just been a few men. It's been all men in that field. You can read the books about it. And they've saved so many lives and so much sickness. And the United States, New York was one of the epicenters of polio at the turn of this last century. Thousands of New Yorkers were dying of polio or being crippled. And it was a devastating disease because it was attacking mainly young people.
That's right.
And there were pictures of hundreds of people in iron lungs, like in school gymnasiums, just filled with little children in iron lungs.
Yeah.
So we owe so much to vaccines, and that's what we're here to talk about today, the vaccine for human papillomavirus. Well, yeah, you're right about cervix cancer, but actually there's other cancers that it's associated with, and the other ones are vaginal cancer, vulvar. Vulvar is the area in a woman around the vagina, outside that skin area.
Right.
Penile cancers, anal cancers, and one of the biggest new cancers is oropharyngeal cancers in men related to human papillomavirus, like Michael Douglas. If you remember, Michael Douglas got on the television and radio and said he got his cancer from oral sex.
Yes, that's right.
And so he must have had human papillomavirus found in the cancer. And there's a big epidemic right now in oropharyngeal cancers in men. It's believed it's related to oral sex. But the biggest victims are not the men, they're the women again. And there's 20,000 human papilloma-associated cancers that occur in women, mainly cervix cancer. Cervix is number one. And 12,000 human papilloma related cancers in men. Oropharyngeal is the most common. So it is affecting tens of thousands of people. And what's the issue? Well, the issue is there's a vaccine.
So we can prevent it, huh?
You can prevent it. You're going to be a pediatrician, right?
Hopefully, yeah.
Oh, hopefully, because you fulfill your wishes. And since 2006, there's been this vaccine, and it was being given to adolescent girls. And obviously, it created a lot of controversy because a lot of parents said, my daughter's not sexually active. I don't want her to have this.
Sure.
Maybe it will give her a sense of some kind of protection or acknowledgement that she might have sex or could have sex. And a lot of parents didn't want to go there. Remember in Texas, in the last presidential election, Governor Perry was out in front vaccinating girls, and a lot of his opponents went after him for that, said it wasn't free will and doesn't represent principles of a party.
That's right.
And he said that when you see someone dying of cervix cancer,